Welcome back to The Explainer. Today we're diving into a big one, a question that comes up a lot for anyone thinking about starting a family. How much does smoking actually affect male fertility? So you're planning a family, right? You hear all sorts of things. Do this, don't do that. But does smoking really matter that much? Well, we're going to dig into the science and separate the facts from the fiction, giving you the real evidence-based answers you're looking for. All right, first things first, let's start with what most of the science agrees on, how smoking directly harms sperm. The consensus here is pretty overwhelming. I mean, the chemicals in cigarette smoke, they basically launch this four-pronged attack on sperm quality. We're talking lower count, less volume, they don't swim as well, and even their shape can get all messed up. And here's the kicker, something that really catches people off guard. It's not just about being a heavy pack-a-day smoker. Nope. The data shows that even lighting up less than 10 times a day can start to reduce sperm quality. It's a real eye-opener. And when you actually put the numbers side by side, smokers versus non-smokers, the pattern is just undeniable. Sperm concentration can be 15, even 20% lower. But it goes way beyond just the numbers. Their movement is impaired, their shape is more likely to be abnormal, and there's a higher risk of DNA damage. It's a clear disadvantage across the board. Okay, so we've talked about count and shape and movement, all things you can kind of see. But honestly, the most serious damage, it's often completely invisible. This gets to the heart of the matter, sperm DNA integrity. Think about it. The sperm is just the delivery vehicle. The real important stuff is the genetic material it's carrying. Smoking causes something called oxidative stress, which can literally damage that DNA. And that's huge. It increases the risk of miscarriage or even genetic issues for the baby. It's not just about getting pregnant, it's about a healthy pregnancy. And believe it or not, the impact doesn't stop at conception. It goes much, much wider than that. Yeah, smoking really hits you with a double whammy here. First, it can lead to erectile dysfunction because it messes with your blood vessels, impairing the blood flow you need. And second, it can throw your hormones out of whack, like testosterone, which is absolutely essential for making sperm in the first place. So it's hitting the problem from two different angles. And this is so important to remember. The risk extends way beyond just you. It affects your partner and potentially your future child. I mean, look at the dangers of secondhand smoke. It can actually take your partner longer to get pregnant. It can reduce the chances of IVF working. And for your future child, the risks are serious. We're talking a higher risk of SIDS and asthma, links to learning difficulties, and for fathers who smoke heavily when they conceive, it actually increases their child's risk of developing childhood leukemia. The data is just, it's stark. Okay, so at this point, the case seems pretty much closed, right? Smoking equals bad for fertility. But what if I told you there's a twist in the tale? A few years back, a study came out that seemed to turn all of this on its head. Yeah, check out this headline from the BBC reporting on a UK study from 2012. It says, smoking and alcohol appear to have little effect on sperm quality. Whoa, that created a ton of confusion. So what was this study all about? And how on earth did it come to such a different conclusion? So let's break it down. The key difference here is what they were actually looking at. That 2012 UK study, it had a super narrow focus. It pretty much just looked at the motile sperm count, how many were swimming. But the broader scientific consensus, all those other studies, they look at the whole shebang: count, motility, shape, and DNA integrity. And that last part, the DNA, well, the 2012 study didn't assess that at all. And that's the crucial missing piece. So, what's the final verdict? Well, this is where it gets really interesting. We have to remember that science is always evolving. It's a process. Our understanding gets deeper as our tools get better. Quitting is still the clear winner, and here's why. Basically, the newer research is able to see the invisible damage that the 2012 study missed. For instance, recent studies highlight things like sperm chromatin condensation, which sounds complicated, but it's super important. So what is sperm chromatin condensation? Okay, think of it like this. Your DNA is this incredibly long, delicate strand of information. Condensation is the process of packaging it up super tightly into the sperm head so it's safe for transport. Well, it turns out smoking messes up that packaging process, making the DNA vulnerable to damage. It's the perfect example of that invisible damage we were talking about. So the big question is, what can you do about it? Well, here's the good news. The damage isn't always permanent. The magic number you'll hear from doctors is 3. They recommend quitting smoking at least 3 months before you even start trying to conceive. But why 3 months specifically? It's all about your body's recovery timeline. See, it takes roughly 3 months to produce a whole new batch of sperm. So by quitting 3 months before, you're giving your body a chance to clear out the old, damaged stuff and produce new, healthier sperm. And the benefits don't stop there. Within weeks, your circulation improves. Within a year, your heart disease risk is cut in half. It's a win-win-win. So the takeaway here is really, really clear. Even with that one confusing study from a few years back, the mountain of scientific evidence all points in the same direction. Quitting smoking is a low-risk, high-reward action for your future family. It's one of the best things you can do. So when you ask yourself, what is the single best health investment I can make for my future family? Well, after looking at all this, the answer is pretty clear. Quitting smoking isn't just about your health, it's about the health of your partner and your future child. It's one of the most powerful, positive steps you can possibly take.